Hello and assalamu alaikum. Welcome to today's show of Hello Doctor, a show that promotes good health in the South Asian community, debunking health myths and answering your questions live on air. For today's episode, it's my first time on. Just to introduce myself, my name is Dr. Akhil Jaigada. I graduated from the University of King's College London. I completed my foundation training in West Midlands, and I am currently a senior house officer in neurorehabilitation. And today, that's enough about me. Today, I have a very special guest with us. We have Dr. Ali Ahmed Shuaib. He is, by background, a GP with a special interest in ENT. And just naming some of the accolades that he's gathered in his very extensive career in the medical profession. He graduated from the University of St. Bartholomew's Medical College. He also has a bachelor's degree in neuroendocrinology. He has an LLM in international law studies. He recently completed his PGC in medical education from the University of Cambridge. And he's been practicing as a GP in Tower Hamlets for the last 12 years with a special interest in ENT with a diploma in otolaryngology from the Royal College of Surgeons. Dr. Shuaib, welcome to the show.
Thank you very much for inviting me. Okay.
Welcome. So we have a packed show today. If you have any questions at any point, feel free to call in today. Just to mention that this is a show that talks about promoting good health. So if you do have a serious medical emergency, this isn't the show to call in. Do call in 111 or 999. But if you have any topics related to the ear, nose or throat, today is the show that you should call in, and you can get the basic information about how we can improve our health in general, specifically in ENT. Dr. Shuaib, just wanted to start off because I think it's very important that the young people who are watching today, that they learn from all the experiences that you have gathered. I know the show is definitely not long enough. However, I think today's show should also be about talking about how we can promote higher aspirations and qualifications in the South Asian community, and you are a great example of that. I wanted to ask, how did you get into the field of medicine?
Thank you for that. Assalamu alaikum to the audience today that are listening in and watching. I think, I've been in the medical profession now, 32 years now it's come to. I would say I'm one of the lucky few that knew that I wanted to do medicine at a very young age, at the age of 12. And would you believe it or not, untypical of South Asian communities, my parents told me, don't be a doctor, do something easy like computer science. So you'll have an easy life. And I said, no, I want to do this, because I've been inspired. Interestingly, my inspiration actually came from Southeast Asia. I was actually living in Bangladesh, in Sylhet, and I had my early formative years in Bangladesh from the age of 11 till 14. And the area that we lived in had about 4 or 5 doctors that used to live in that area. And they were my friends of my father. And their mannerism, the way they dealt with me, they were inspiration to me, I'll be honest with you. And that for me said, if these are what doctors are, I want to be like one of them. So in a way, that's how it started off. I didn't know I was actually good at studies or academically, but I matriculated in Bangladesh, did my SSC exam, and only then I realized actually I may have an academic ability to maybe study further. And that was, in a way, gave me the sort of leg up to study. And I came to the UK, did my GCSEs in a year, did my A-levels, and then the rest is history. And that's going back years. So in a way, I think medicine was a career that was pretty much very early onset. I haven't looked at any other career. I probably would have studied, if I didn't do medicine, probably would have studied Arabic and political science, which may also indicate my other sideline studies that I have done. But so it was something that was probably early onset that I gained. But
you mentioned that you were in Bangladesh from the ages of 11 to 14.
Yeah.
That's very unorthodox. How did that shape you in becoming the person you are today?
It is probably in my years of learning, I would say that 4 years has been the most formative years of my entire education. The fact that I was uprooted from a different system to a completely unique system of learning. I went to a very private sort of Islamic school in Bangladesh, which taught both the Arabic side as well as the sort of conventional educational curriculum, and also interacted with people, which was one of the biggest things that I think made me where I am today. Yeah. I started to understand the culture, the nuances within the society and the community, being able to interact with both the old and the young. And so being able to interact with different age generations has shaped me a lot. given me that mental maturity that I needed for so much.
Oh, yeah.
Yeah, so I think that was very important. Language-wise, developing language, being able to speak Bengali, both Sylheti and a little bit of, sort of Shuddha Bangla, I was able to, allowed me to be able to communicate with my patients later on in life, and has helped a lot.
MashaAllah. So regarding the ear, nose and throat, you are a specialist in this and also a GP. We know that this time of the year we have hay fever, we have the heat wave, we have all these issues going on. Could we talk more about these common conditions and certain ways that we can help manage, let's say, hay fever, for instance?
Sure. So I think the hay fever, everybody knows it as a seasonal illness. One of the things that people don't realize is that, it comes under the umbrella of something called allergic rhinitis. That is the medical term. You may come across it. Now, allergic rhinitis broadly is classified into two. One is seasonal, which is hay fever, and one is perennial, which is throughout the whole year. And those, the throughout the whole year one is usually allergies to dust mite, cat, dog fur, cat dander, and various other environmental pollutants that can trigger off an allergy. Whereas seasonal one, which the hay fever one, is usually pollen. Pollen is the most important one, and that everybody knows about. But what people don't know is how common it is. Now, allergic rhinitis, if I told you that 1 in 4 people in all of society actually suffer with it, whether it's a mild, moderate or severe form. So most people actually don't know they have it. They have a stuffy nose throughout the year, fine, it's a bit of a cold, and they don't realize it. But when it comes to hay fever, so many people have what we call the background perennial rhinitis. However, on top of that, they develop the seasonal allergic rhinitis.
Oh, okay.
And so they have
You
multiple
double
allergies.
almost.
Yes,
Okay.
multiple allergies. And therefore, they only seek attention or medical help when it comes to when it's severe form. Managing it is ultimately, I think, the standard treatment. As you know, historically, GPs used to give antihistamines, nose sprays, and they're all antihistamine. One is a steroid spray in the nose, and also for the eye drops, depending on your symptoms. But these days, the pharmacists issue that, and you don't really need a GP for it, for moderate symptoms or mild to moderate symptoms. Severe symptoms require a bit more specialist intervention, and because not all antihistamines work for people, and some are more sedating than others, and therefore you need a little bit more nuanced approach to it. But I tend to say to my patients, generally, it's about trying to start, especially with hay fever seasons, is actually maybe think about it, since it comes around every year. Since it comes around every year, it's worth thinking about it a little bit before the season. Because if you actually start some of the treatment before the season starts, your severity of symptoms are significantly lower. So like, for instance, if you have a nose block and you're sneezing and itchy eyes, if you start, say, the antihistamine about a week or two before the symptoms kick in, you can actually have a significantly lower sort of suffering throughout the period. Because
I think I need to take this advice on, because I'm a main sufferer of hay fever. To the point it becomes debilitating. You go to the park, you sit down and you're thinking, oh, I know it's going to be one of those days, it's going to ruin my day almost. So these are very important tips. Audience, if you have any questions regarding hay fever, you can't control it, or you're finding maybe is there something else that can help another symptom of mine, for example, itchy eyes, blocked nose, do call in and we have an expert in the field, so we can try to answer those questions as much as possible. Going back to yourself, Dr. Shoaib, why did you go into the field of ENT?
I think, in a way, I fell into it accidentally, I'll be honest with you, because majority of, as a doctor or as a medical student, you actually only get a very limited exposure to this field of ENT. ENT as a specialty, or otolaryngology, is actually a postgraduate subject, mainly. You only, and if you remember from your medical school days, probably out of the 5-6 years you've studied, you only had 2 weeks.
I'm just going to mention it to the audience. ENT, I know we're using it as an acronym, but all it stands for is ear, nose, and throat. And that's what we mean by ENT.
That's correct, sorry. So ear, nose and throat medicine or surgery is a surgical and medical specialty combined, really, because a lot of the management is medical and some of it is surgical, but you train as a surgeon for it. Now, I was saying that it is something that very poorly taught at medical school, only maybe 1 or 2 weeks of exposure. So majority of people who, when they go to their doctors, especially the general practitioners, they haven't had the training or the exposure to these kind of conditions. And what's fascinating I found, and I sort of, as a surgical trainee, I went into an ENT rotation and I loved it in the sense that within such a small area.
We have a call on the line, Dr. Shoaib.
Yeah.
Hello, caller, can you hear me? Hello, caller, who's calling?
Assalamualaikum.
Wa alaikum salam.
I'm suffering hay fever quite a while now. It's nearly about 10, 15 years. Now,
Sorry, what are you suffering from? Say that a bit louder.
Hay fever.
Hay
Sorry?
fever, okay, yeah.
Yeah. Recently, I found the, sleep apnea, in the night time, and the nose most of the time is blocked.
Yeah. Sleep apnea is especially another topic that we can talk about. Thank you for the question. Let's try answer that.
So,
thank you.
Thank you for your question. Assalamu alaikum. The question really, so two aspects here. One is the sleep apnea is a very complicated topic in the sense that there is more than one aspect affected. So it is, the people who may not be familiar with the term, it is basically in your sleep, your oxygen level drops because you cannot breathe enough or well enough to get oxygen into your lungs. So generally, I ask my patients, so when you're sitting in front of me awake, why do you not snore and why do you not stop breathing? Because the answer is the body controls the flow of oxygen without you realizing. When we sleep, the whole body relaxes. Everything goes into a suspended mode.
Yeah.
So the body then goes for the easiest route to breathe. Now, if your nose is a little bit blocked, then it doesn't like the nose. It says, no, I'm not going to use the nose to breathe. I'm going to go for the other route, which is the mouth.
Yeah.
So most people who have a slightly blocked nose, they tend to be mouth breathers. And at night time, when they're breathing through their mouth, the mouth becomes very dry.
Yeah.
But what happens is the mouth is not designed for breathing. The saliva is for food, not for moisturizing the air that goes into your lungs.
Yeah.
Because when we're asleep, the tongue, which is a muscle, falls backwards and actually sits on the airway.
Yeah.
And therefore, when we're trying to breathe through the mouth, the tongue gets in the way. And if you have a slight weight issue, possibly a neck that is slightly bigger than what it should be, then that weight also collapses on that area. And it's known as Velopalatine Collapse. That's the technical term. And it covers the airway.
Yeah.
And it stops people from getting air in. And hence the sleep apnea potentially can develop as a result. So in that situation, there are, in an ideal world, sleep apnea should be managed by ENT surgeons, as well as respiratory physicians, and it should be a combined clinic. Unfortunately, due to lack of money, funds, and service provision, it's a little bit disjointed. So depending on the area you live in, you may get an excellent service where you go into a clinic and it's two specialties sitting together and handling, or sometimes you have to find your way around.
Yeah.
So often I say to people, start off with the first thing. So I will assess my patients, I will check their nose, the back of the throat, I will take their history.
Yeah.
One of the key indications, and sleep apnea, and I'm really glad our caller called in today, majority of people don't know they have sleep apnea until they're told. And sleep apnea is a silent killer. Let me stress that to you. Sleep apnea is a silent killer. Why? Over years, if you do not treat it, it will affect your heart and your lungs. And you cannot reverse that. So it actually slowly destroys the heart tissue and the lung tissue. So it is very important that it's picked up early and treated early because of the lack of oxygen. So majority of people tend to be tired in the daytime because they didn't get a quality sleep at night. And what you'll find is that because of that, the lethargy is there in the day and they can't sleep at night. So it's a vicious cycle.
Is snoring a good indicator that you might have sleep apnea?
It is the beginning of potential sleep apnea. So not all snorers have sleep apnea, but majority of sleep apnea patients have snoring.
Okay. So if you are snoring, then maybe we could look into possibly saying that if we do have sleep apnea, what would the management be for sleep apnea? Because I know when I was doing my respiratory rotation, a lot of patients came with sleep apnea. We did sleep studies with them, and some of the general advice we gave them is if you're overweight, lose some weight, healthy diet, making sure that before you sleep, there are certain machines that you could also use.
Correct.
Do you want to elaborate on that?
Yeah, absolutely. So I think the management really depends where the problem is in terms of obstruction. So let me very quickly run through. It can be anywhere. So if somebody has a nose problem and a blocked nose, so they can have a allergy problem that needs to be treated. if they can have a structural problem of the nose where the septum, which is the bone in the middle of the nose, is actually bent and therefore blocking a physical obstruction. If that's the case, then they should have surgery for that and actually correct it. If they have weight, significant weight, so for instance, a collar size of 17 or 17 plus, 17 and a half, is usually an indication for sleep apnea. So if your collar is more than 17 and a half, you need to lose weight, and chances are you have sleep apnea. So that's another way we look at it. And then also inactivity, lack of physical activity. What does it do? It reduces the tone of the muscle of the body. And when you're asleep, it's more collapsed. So if you're somebody who exercises regularly and keeps the tone of your muscles, you tend to find that even in sleep, your muscle tone maintains and your airway keeps open. So these are non-operative measures one can take. And subsequently, if that doesn't fit, then for instance, you need to look in the throat. If your tonsils are big and they're collapsing, their tonsils are graded from 1 to 4, and the 4 tonsils are touching each other. Majority of people have either 3 or or less. Then sometimes a tonsillectomy can help that as well. And then other devices that are available. Some people have their jaw, which is what we call slightly misshapen, or the way it is fitting on their face, it either goes backwards, so when they're asleep, it falls backwards. In that situation, they can see a dentist to get something called a mandibular advancement splint, which is like a little night guard that keeps the jaw forward, keeps the tongue forward. And the last but not least, there is something which respiratory doctors often give, and most people hate it, is you wear a mask at night called a CPAP machine mask, which is the only way to get oxygen into your lungs. But it is something that you have to have regularly, and it's something that unfortunately, but it makes a life-changing effect on you if you have that.
There's so many different routes to get your investigation for sleep apnea. Would you say going to the GP is the best route?
I think GP definitely best route, and they should refer you to the local sleep clinic. And in Tower Hamlets, where I work, sleep clinic is the first port of call. Because I'm also an ENT specialist, my patients tend to see me first quickly and get the ear, nose and throat sorted before they go into the clinic. But most places won't have that, and therefore they need to have but sleep clinic would be the right place.
Fantastic. Hopefully, caller, that gives you a good understanding what sleep apnea is, and some of the risk factors for sleep apnea, and also ways that we can manage it, and also the ways that you can look into the NHS to make sure that you're getting the management that you need. Going back to the question, Dr. Shoaib, so we cut off halfway through. You mentioned that ENT was not something that you were looking into because in the medical school, we don't really get much spec into ENT.
I didn't know much about it, I'll be honest. And then I came into this job because I wanted to do something within surgery initially. And then I enjoyed it so much because in such a small area, you have so many different conditions going on. And that fascinated me. And it was an area that you could, because interestingly, in general practice, 20% of all complaints are related to ear, nose and throat.
Oh, interesting. Okay.
And it shows, I mean, if 20% of all presentations in general practice are ENT related, you'd expect GPs to be trained more in this subject. And it's an area that I'm looking to pick on and take forward in my career as an educator in medicine as well. So
that's fantastic. So as mentioned, Dr. Shoaib has a PGC in medical education at the University of Cambridge, and part of that role is to make sure that he can train the future doctors, and one training that I think every doctor needs is in ear, nose and throat. And so hopefully within the next generation we can have a lot more doctors who are well versed in ear, nose and throat. And it's a staggering fact, 20% are complaints are regarding ear, nose and throat. I think we have another caller. Next caller, please. Hello, and where are you calling from?
Assalamu alaikum. I'm calling again back from also in West Midland. Because just asking to Dr. Shoaib.
Yes, please.
The ENT specialist saw me and they had done my SMA training, and also they gave me Monticulus 10 mg, which is on regular basis taking. And also they gave me nasal spray and eye running, nose for these things. But still, these things are not helping me a lot. I'm still suffering and badly. And even though if I eat something, and Dr. Shoaib rightly said, in the night time my mouth was very dry, and when I wake up early morning, I'm so thirsty and a very dry mouth.
Sure.
Do you have any suggestion to how do you have to resolve this issue?
Sure. So I think with something like this, as you probably would appreciate, every doctor has his eyes that they look at the patient and they gauge whether this patient, and some doctors will miss something and others doctors. It's always good to get a second opinion. I think in your case, if you have seen the ENT doctors, so it sounds like you have bad allergic rhinitis, for you to be issued with something like montelukast, which is a second drug that you would use in bad. So you have to remember, allergic rhinitis is like asthma of the lungs. So this is known as the asthma of the nose. That's the other term we use for it.
Yeah.
So like asthma cannot be cured, allergic rhinitis cannot be cured, but it can be reduced.
Yeah.
So I think managing your allergic rhinitis is one element. But however, I would say to you, possibly looking at, I don't know if your weight is an issue for you. If it is, that is worth definitely looking at. And also looking at something called maybe asking the ear, nose and throat doctors or your GP to ask for a sleep nasal endoscopy. So there's two types of, one is a sleep study, which is one where you are put to sleep and they just check the oxygen level. And the other is a sleep nasal endoscopy where I will put a patient to sleep under and about to go off to a general anesthetic, but halfway. So I try and create what we call an artificial sleep status in theatre, and I'll pass a camera down the nose and look at where the block is. And you can actually often see. So that's something potentially your doctor could actually ask for. I would, because I don't know which area you live in, but depending on your area, it is possible to get a second opinion in ENT and to see if you need further. So you mentioned, I think, SMD2 turbinates, if I got correctly. Is that correct? You had a surgery to your turbinates?
Yes, that's right. SMR trimming.
SMR, submucosal resection. So that would have improved your nasal airway. Are you still finding difficult to breathe through your nose?
Yes.
Yeah. So there may be, this is where, so that has not been successful in getting your nasal airway established. You may need further surgery. And I would insist on the GP to send you back. If necessary, go to another ENT department. You have a choice as an NHS patient. You have a choice to pick the hospital you want to go to. Don't be restricted to the hospital that is in your locality only.
Okay, I think that's amazing advice. Hopefully that is the answer you were looking for as well. And so as mentioned, that you have a right to look into the hospital that you want to be investigated in. So do go back, and if there is a hospital nearby or has a service that you think that can help you, that is also a route that you can look into. The first section has gone very fast. We only have a few minutes left. I'm going to wait until it's finished. We've got about 2-3 minutes left, but I do want to go back to the question. Hopefully we can answer it this time.
That's okay. That's all right.
And if not,
I think, look, ENT was fascinating.
Yeah.
It involves, just as a specialty, it is a combination, both surgical and also medical. Yeah. And I like the combination of the two. You use your mind a lot as well as your hands. Yeah. So in a way, there's you a winner on both sides as a specialty. Nothing more than that. And to be honest with you, another thing I've learned in education, if the people that train you, if they're nice, you tend to stay in that subject.
This is the nail on the head. If the people who train you are nice, you stay. One of the reasons I love the profession or love the speciality is because the teachers or the doctors, senior doctors, their manners are different. Yeah. I used to remember when we used to work in certain hospitals, the consultants were the most friendliest to the patients. They were like, "Hi, how are you?" Take a knee down, speak to the patient at eye level, and it's stuff like that. It's not just the medical education; it's stuff like that goes, I think I want to be like this person. I want to go into that speciality. Did the same happen to you?
Absolutely. I mean, I would say to you, I was one of those rare few that has done every specialty other than ophthalmology, the eye specialty. And as a result, when I came into general practice, I was actually 10 years in hospital subspecialties before I moved. So nothing fazed me. I've done neurosurgery as a whole year. So even anything neurological wasn't a problem. So what I found was experiencing different specialties has really paved the way for me as being a competent, hopefully a competent general practitioner. Nothing walks through the door that scares me or befuddles me. I can find a way around to solve the issue. Yeah. So, I think the specialties I like most, general practice, is because I had fantastic trainers and they're very kind and compassionate people, and in ENT surgery. The other departments varied a little bit. So I wasn't really keen on those.
We have only a minute left in this section. There is a caller. We will take the call and then we will hopefully answer it after the break. Caller, hi. What's your name? Where are you calling from?
Yeah, my name is Anwar.
Yeah.
Calling from Forest Gate.
Okay. How can we help you today?
Yeah. Can I speak to a doctor, please?
Yeah, Dr.
Yes,
Shoaib is here.
Yeah. Yes, Anwar, Mr. Anwar.
Yes. Well, I have blocked nose and blocked ears.
Okay. Have you seen anyone about it?
I saw a doctor a long time ago, and they told me I got a little bit of, and bone is not straight. That's what they told me.
Well, in your nose.
Yeah.
And what about your ears?
Ears are blocked.
They feel blocked.
Mm.
So have you had somebody look in your ears with a
my
little
tonsils are quite big as well.
tonsils?
Yeah, tonsils are quite big as well.
But when they look in your ears, did they comment on what they saw in your ears? Were there wax or problem with your eardrum, anything like that?
They said it's no wax, but they said it's quite like 19 years ago I went to hospital. And then I didn't go again.
I see. So it may be worthwhile. How much time do we have?
How much time do we have?
Sorry?
Sorry.
Okay. So we can
answer this?
We can take a break after we answer this question.
So, Mr. Anwar, thank you for your question and what you've been presented. I think it's worth you, if you haven't seen a doctor for this, it's worth revisiting. And I'll tell you the reason being is that your nose may be responsible for your blocked ears because the nose is connected to the ear. It's not randomly chosen, the ear, nose and throat as a specialty. There are connection between the two. So there's a tube at the back of the nose called the eustachian tube that connects the middle ear and ventilates, meaning passes air, goes into the middle ear. So if that tube is blocked because your nose is blocked, then that could be a problem why your ears feel blocked. So importantly, somebody needs to look in your nose, somebody needs to do a hearing test on you to see that your blocked feeling in your ears is not because it is because of a hearing loss as opposed to a problem with the eustachian tube. So I would strongly recommend you do this, and you shouldn't shy away from revisiting a doctor if you're not happy with the management.
Yeah, I think that's
excellent. See you about it, please.
Say that again.
Can I come and see you about my problem?
So I'm based in Tower Hamlets. Because you're in Forest Gate, you can ask your GP to refer you to something called the Communitas ENT clinic, which I'm one of the specialists in. So I also work in Newham on certain days. You can ask them to refer, and when you get the appointment, you can ask them to basically put the appointment towards my clinic. Yeah.
Can you hold on, please? Let me just write it down. Yeah. Can you hold on, please?
No worries. Yeah. So yes, it's Communitas ENT clinic. We can mention it at the end of it.
Yeah.
It's not
what we can do as well is we can pass it back to the main studio and we can give you the details there.
Yeah.
This section we've actually answered a lot of questions. We're going to go through our personal questions that we're going to go through. But next section, we're definitely going to try and get through them and also answer all the other questions that you may have. The first section, thank you very much, Dr. Shoaib. We've learnt a lot about hay fever, sleep apnea. We learnt about how the ear, nose and throat are all connected together. In the next section, let's go into a bit more about that and also talk about all the medical aspirations that the young people who are wanting to go into medicine and how they can go into medicine can be possible.
Love to hear from them, actually.
Yeah, if young people, please call in. Yeah, but for now, we're going to go into a very short break. Thank you.